that they do believe can be a risk factor. Okay, now antioxidants, this is something separate, I'll go over that. So, fats. They believe that diets that are high in fats have been linked to breast cancer. Okay, and please understand that breast cancer, yes, is more common in women, but men also develop breast cancer. Okay, so this is across the board. So diets high in fats have been linked to breast cancer. Fiber. Diets low in fiber have been linked to colorectal cancer. Diets low in fiber have been linked to colorectal cancer. And kind of recently, well not so recently, you guys may have heard that they are linking smoked meats to cancer, and more so colorectal, but some other cancers as well. So yes, chorizo, all the sausages and the bacon, all those nice tasty smoked meats that we eat.
Like barbecuing things too?
Yeah, so too much of it. Okay, so this is what happens, and this is the philosophy. When, especially smoked meats. So when you have, I knew some neighbors of mine when I used to live in Jersey. They had a smokehouse in their backyard, and they would make their own sausages and everything. So when you take meat and put it in the smokehouse, okay, so it can get all that smoky flavor, so it tastes good. The issue is this: they believe that, you know how when you, with the tobacco, you're smoking and inhaling, they believe that you're ingesting it. So they believe that the carcinogens do come off of that same smoke, and you're ingesting it, and it gets inside. It's also the same type of cancer.
Colorectal.
Well, they say more so for colorectal, but it's also other cancers as well. Actually, was another study I looked at with smoked meats with pancreatic cancer too. So it can be for a number of cancers. So pancreatic, colorectal. So everything in moderation.
But that was just for the smoker, or was the smoker and grilling too?
They say grilling too.
Grilling too?
So
Both better.
I know, I like barbecue too. But the thing is, again, this is when, and we don't want to say, okay, on 4th of July, you have some barbecue. But, you know, constant.
And we eat a lot.
You know,
We grill a lot.
have high, constantly.
So it's like every day for a year or something like that, or we just?
Well, I don't want to give an exact, you know,
Yeah.
but definitely, that's why I say everything in moderation. So say if you have someone that has a diet, and usually people that eat a lot of smoked meats, they do unfortunately have a high fat content in their diet too. So a person that's eating bacon every morning, and then bacon on their burger for lunch, and then let's say they're always, you know, eating some sort of sausages and heavy meat eaters and, you know, those types of smoked meats, you know, just constantly, I want to say like every meal, okay, that kind of leads them to that, you know, let's say a risk factor. Yes.
So frying it on a pan on the stove is healthier than putting it on the barbecue, or is it just?
It's different than.
I don't want to say it's much healthier in the sense for cancer related, but it's not healthier to fry.
No, but it's like cancer related.
Yeah, cancer related, yeah, you can look at it that way. But their concern, like I said, with the smoked meats is the actual smoke itself, that they believe that the carcinogens are within that smoke. And that's why I use the example of a smokehouse. If anyone ever seen a smokehouse, okay, if you ever go to a place where, or I don't want to say, or wherever they make sausages and things like that, and they put it in the smokehouse or certain meats and they hang it up, okay, and just get that smoky flavor, okay, they sit in that smoke for a period of time, and then so basically then you're ingesting that, okay, so that's kind of more so the issue. All right, so alcohol, yes, too much alcohol has been linked to cancer, so it has been linked to breast cancer. It's also been linked to esophageal cancer and liver cancer. Okay, so breast, esophageal, and liver cancer. So I'm gonna tone down on that too. All right. So antioxidants, we know that this is different. Okay. Antioxidants, I think we all know, is naturally found in some fruits and vegetables, and especially berries. They say that it's good to have a diet high in antioxidants, okay? Because what antioxidants do, just what it says in the name, antioxidation. So it actually stops that oxidation process to stop the disease process, okay, from occurring. Antioxidants are good not only for just cancer, but even any disease that can develop in the body, okay? So I don't want you to think it's just for cancer. Yes?
Would sugar not be included?
They don't have sugar, but sugar, from my understanding, yes, has been linked to most GI cancers, like
Relative to
liver and.
I thought that the cancer feeds off of sugars.
Cancer feeds, it depends on what stage it's in.
Okay.
Yeah, it depends on what stage it's in. When patients do have aggressive cancers, yes, they do tell them to minimize certain types of foods and have a certain diet. Cancer can feed off of sugar and kind of replicate and make it faster. But they don't really get that deep into changing the diet right in the beginning, like if it's like a stage 1 or 2. But like later on, if it's aggressive, they really try to minimize certain things. Yes.
My dad had lung cancer, and in the PET scan, they use a dye that is linked to a sugar molecule to
Yeah, that's why.
absorb into, like, he had adenocarcinoma,
Yeah.
It's a radioactive.
but yeah, it was
sugar.
really aggressive, so.
Oh, it was aggressive, so they were able to.
No, he passed away, but,
Oh.
I mean, no, it's fine. I would, anyways, but I just thought it was interesting to.
Yeah, that they
use
use
sugar
that
to find.
it.
Different.
Yeah, because the cancer, the cells actually go right to it, and it'll just kind of help. It's almost like what am I thinking about? It's something else that cells feed off of with sugar, like bacteria, almost. Like sometimes bacteria feeds off of sugar. Yeah, so it's kind of the same thing a little bit. Okay.
So antioxidants are good.
Yes, antioxidants are good. That's what you want to have. You want to have a diet high in antioxidants as much as you can, because that helps stop the disease process, okay, or stop it from starting. Now, let me try to get through what I can. Your PowerPoint is already tailored, so you don't have to skip any slides. This is the long version. I cut out a large portion of genetics with this chapter, things that you don't need to know. Okay, you want to try to keep it more clinical. I'm probably sure you don't want that. Okay, yes. So we want to try to keep this more clinical based. The genetic portion of it, if we were to have a course in genetics, I'm probably sure you'll go into a lot of detail with that. Those of you who are taking what's the course? Capstone. A lot of you taking capstone. Okay. So in capstone, you guys get a chance to go into like research with different things, and so you may utilize maybe some portion of that if you're doing that as your topic, like cancer research or something like that. You'll get into more detail with that. Okay. So for this class, we're just going to sit clinically. So let's go right to metastasis. So what happens when cancer spreads? So when cancer spreads, and I'm going to try to rush, I'm going to talk a little faster because, like I said, I want to stick to my word and try to get you out a little bit. When cancer spreads, it actually will spread, as we know, through blood and lymph channels. And metastasis meaning that it will leave that organ where it originated from and now go to a totally different site. Okay. And so, how does this occur? What happens here is this: these cells, these cancer cells, do have enzymes and receptors that do allow them to just pretty much infiltrate whatever tissue it wants. So do you guys remember the movie Look Who's Talking? In the beginning, I know I'm dating myself. It's an old movie. Look Who's Talking. So in the beginning, the sperm swims to the egg, okay, and it just melts the coating and goes in. So remember, the sperm head has an acrosome, that enzyme, and it just melts the coating of the egg so it can get inside to fertilize. Pretty much the same situation that happens here. That cancer cell will go to that site of the tissue, It has a receptor and an enzyme that will bind, that will break the coating and go right inside and now infiltrate that tissue with the cancer cell. So that's how it metastasizes.
Is that different for every type of cancer, which enzyme and
Yes,
receptor?
exactly. And that's how, when we get into the next, I want to say 2 slides, that's where those tumor markers come into play. So, knowing tumor markers, oh yeah, this slide. Knowing tumor markers are very key because certain cancers do behave certain ways, and they do know that some cancers metastasize more frequently to certain areas. So they're able to track the activity. So yes, they are different. Okay, so this particular slide coincides with that table that I told you guys, table 7-6, with the tumor markers. So again, all you have to do is just memorize on that table the top 4 cancers, okay, to make your life easier, because it's a lot of information on that table. Tumor markers come from the parent cancer, okay? So the body will never trick itself thinking, okay, where's the primary cancer? So the primary cancer will always release an enzyme or an antigen or a hormone, whatever it is, okay, to let you know where it came from. So this flows through the bloodstream and it can be tested in blood work, okay, which would be a special panel that you guys would have to order for that. And so what happens is this. Knowing this, as we said earlier, as you said, yes, it is important to know because each different enzyme, each different hormone, or each different cancer has a different activity. So they can track tumor activity by knowing the exact enzyme, okay, so which also helps with management of the cancer too. So they'll kind of know how to manage it as best they can. Okay. So, angiogenesis. We've kind of discussed this already, so we know that there's a lot of blood vessels surrounding the tumor, so angiogenesis meaning just the formation of blood vessels. Malignant tumors continue to have a lot of blood vessels, and they continue to grow and grow and grow until it's treated. So the goal here is to try to inhibit that. So like I said, radiation therapy, they try to shrink it, kill those vessels to stop it. Grading and staging. So, like I told you before, when a biopsy is done, they'll take it to the lab, the pathologists look at it and figure out what's going on. So, they do have grading for what's happening at the tissue, so different than staging. So usually when you hear cancer, people say stage 1, 2, or 3, or whatever. But a grading procedure is what happens in the lab. Okay, so they grade the tissue. So just know grading, histology. Okay, so it all depends on what they're looking at. Staging is looking at the patient. Okay, so now staging is staging the activity of the cancer. So is this just a localized tumor, maybe in the lymph node? Has this now spread through the whole chain? Is this now going to another lymphatic chain? Or is it now in another organ? So this is how we stage the patient. So stage 1, obviously not as complicated, 2, 3, 4, okay, so forth. And so staging is important because you need to know, let's say, like I said, if we have like one single lymph node, okay, radiation therapy may be the choice of treatment and they can localize it, okay. However, if you have someone that has like metastasis amongst a lot of different organs, then that person will probably need more chemotherapy, okay. So they use this staging procedure to kind of help with treatment modalities. This is a PET scan. So they use this type of nuclear scan to figure out where is this activity, okay, occurring. And so just by looking at this, this is not going to tell us the primary issue or the primary tumor. However, it tells us which areas, okay, which organs have been infiltrated with cancer. Effects of cancer on the body, this is just an intro to the next thing. So, very quickly, I do need you to know what are called the warning signs of cancer. Okay, please make sure you know this acronym. To be honest, I've seen this in an NCLEX review book as a question. They want you to know these actually fall under the category as signs or symptoms of cancer. Okay, So just to take the first one, for example, change in bowel habit, probably for someone that has colon cancer. Change in bladder habit for bladder cancer. So if you go through, you'll get the picture. Okay, but just also remember, memorize the whole thing, the acronym. Now, the next one here are warning signs in children. This also has an acronym. Now, major thing, and I've also saw this as an NCLEX type question too. The issue is this: when children have signs and symptoms of cancer, it is actually the same signs and symptoms as day-to-day childhood disorders. Okay, so this is the scary part. Children, we know day-to-day things. They go to daycare, okay, or school. They're putting their hands and fingers in places, okay. They put things in their mouth and they're touching everybody, and we know that they pick up everything under the sun, okay, when they go to school. Also, their immune systems are weaker, which makes them a little, vulnerable to having more infections and things. So the signs and symptoms of infections that they get, and fever and things like that, unfortunately are the same signs and symptoms that develop when they have cancer. So sometimes it's, I don't want to say overlooked, but a little underdiagnosed, okay, or diagnosed too late. Sometimes because they do share the same signs and symptoms. So again, the big picture here is that the signs and symptoms of childhood cancers are the same signs and symptoms of normal childhood infections and disorders. Pain, we know, can be amongst any disease or condition, and so cancer patients do have a considerable amount of pain, whether it's from the metastasis or just localized tumor. That can be taken care of with analgesics or whatever type of pain management you guys have to do. This particular one, I can never get this out. Cachexia. This is also known as wasting syndrome. Okay. As you know, or may have heard of, sometimes when patients do get into like maybe later stages, like a 3 or 4, they do become very weak, very thin. They lose a lot of weight. And the reason for that is because, number one, they do lose an appetite. One of the reasons why they lose appetite, sometimes the cancer treatment kind of disrupts the lining of the stomach. And they do have a fast metabolism, which makes them lose weight a little rapidly, with nausea and vomiting. It also suppresses the immune system, okay, which I think you know. So what happens here, going into the next slide, bone marrow suppression. Bone marrow suppression occurs, okay, with cancer, so which means that all of the blood cells will decrease in number, okay. So just to take this really quickly, if you have a decrease in red blood cells, we know that it leads the patient into what? An anemia. If you have a decrease in white blood cells, what do you think that's going to make this patient more vulnerable for?
Infection.
Infection, very good. So they will definitely have secondary infections from this. Thrombocytopenia, if you have a decrease in platelets, what could this possibly lead to? Bleeding, excess bleeding, because they don't have enough platelets, okay? So just keep in mind, those are all things that can develop, okay, depending on the blood level. Hair loss and mucositis. I think we know about the hair loss, and what happens is this, especially when we talk about chemotherapy. Chemotherapy is just kind of an overall situation where we try to, it doesn't really target the cancer cells. We wish we could do that. Unfortunately, chemotherapy is almost like a clean sweep, okay? So unfortunately, chemotherapy attacks the rapidly dividing cells, okay? And so the most rapidly dividing cells outside of the cancer will be epithelial and blood, which is why they have the hair loss, which is why sometimes cancer patients also can have the sometimes skin lesions, okay, because it attacks the epithelium. It also attacks the epithelial lining in the GI tract, which makes them a little more difficult to digest food and makes it uncomfortable. What is called mucositis, that's mucositis, the mucus lining in the stomach, it's an issue. Okay. Paraneoplastic syndromes, just really quickly, the endocrine signals and function can also be off, obviously, if everything else is going on. Okay, now this is where I'm going to sum it up. So the treatment therapies. Surgery we know can be used for those things that are operable. Okay, so if they can go in and remove it, great. Radiation is used, I would say, more so for localized tumors that they can sort of radiate, not something that's disseminated all about. Chemotherapy and drug therapy, sometimes in combination, they call it, what do they call it, like a cocktail that can be given to make sure that they can just try to do what I call like a clean sweep, okay, hoping to attack those cancer cells. Now, some of the emergent therapies are this. If you have sometimes cancers that are rare or cancers that don't react to the normal mainstream therapy that's used, they can use things like immunotherapy so they can kind of give them an immune boost, okay, give them immune cells to boost their immune system to fight the cancer. Target molecular therapies or stem cell transplant. Now, we're going to go into detail with stem cell transplant next week, okay, when we talk about leukemia. Okay, I'm stopping here. The rest of your PowerPoint just goes into detail with each and every one, and I just tried to sum it up for you. And let me turn this off. Okay, so just really quick, next week's test, please make sure that you cover everything